For more than a decade, self-proclaimed mightiest prophet of the Lord, David Owuor has held massive end-of-year crusades that attract tens of thousands of followers from across Kenya and beyond. At the center of these gatherings are extraordinary claims that incurable diseases, including HIV and AIDS, are miraculously healed through prayer. To support these claims, Prophet Owuor's ministry frequently presents what it describes as medical proof. Health professionals, laboratory results, and hospital records are displayed before the media to certify that individuals who were once sick are now healed. But an investigation into one such event raises serious questions about how these healings are verified. During a media briefing organized by Owuor's church in Nakuru, pastors presented a group of patients said to have been healed of various illnesses. Special emphasis was placed on HIV and AIDS cures, among the most sensitive and medically complex claims. The church arranged visits to patients' homes, where relatives were interviewed as witnesses to confirm that their family members had once been sick and were now healed. Throughout these visits, the patients were accompanied by doctors who identified themselves as members of Owuor's church. These doctors carried medical documents allegedly showing when each patient had tested HIV positive and later tested negative. The records were said to originate from well-known institutions, including Kenyatta National Hospital and Nakuru General Hospital. However, concerns emerged during an interview with the chief laboratory technician at Nakuru General Hospital. As he explained the hospital's HIV testing procedures, including advanced confirmatory tests, a critical request was made that one of the patients publicly claimed to be healed be retested on camera. Initially, the laboratory technician hesitated, but after persistent questioning, he agreed, on one condition, that the patients themselves consent. When asked, the patients agreed to be tested on camera. They stated they were ready, provided the pastor accompanying them approved the procedure. At that point, the situation took an unexpected turn. When the pastor was asked to give the go-ahead, he claimed the laboratory did not operate on Saturdays. This was immediately disputed. The lab technician had already confirmed he was ready to conduct the tests, and the patients had consented. The pastor then appeared to take a phone call and quietly left the scene. He did not return for the remainder of the interview. Instead, the team was redirected to two homesteads, one in a low-income settlement, the other at Egerton University staff quarters, where relatives testified that their mothers had been healed. One of the alleged beneficiaries was a university lecturer. Yet no independent, real-time medical testing was conducted in front of the cameras. What emerges from this investigation is a troubling pattern. A tightly coordinated system involving selected medical professionals, curated documentation, controlled media access, and spiritual authority, all working together to reinforce claims that are never subjected to open, independent verification. Further observations suggest the existence of a broader support network, including financial backing from South American sources and an aggressive online presence. Social media influencers aligned with the ministry frequently target and discredit journalists, doctors, and citizens who question the authenticity of the healings. This raises a critical national concern. Faith plays a vital role in society, but when medical claims involving life-threatening conditions are made without transparent, independent verification, the consequences can be deadly. History offers painful lessons of what can happen when unquestioned religious authority overrides medical truth. If such claims continue without independent scrutiny, Kenya risks repeating the painful lessons seen elsewhere, including historical cases like the 1978 Jonestown tragedy in the United States, where unchecked religious authority led to the deaths of more than 900 people.